Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vetrehabbers, today Anae is unpacking a powerful survey-based study involving over 6,000 dogs across the US and Canada, and it takes a deep look at whether they're intact, neutered, vasectomized, or have been spayed, leaving their ovaries, and how this impacts on long-term health and behavior. So we explore how these choices affect everything from the risk of orthopedic conditions like hip dysplasia and elbow dysplasia to behavioral changes that can influence a dog's overall quality of life. Now, with alternatives to traditional spay and neuter now in the spotlight, we need to ask ourselves what's truly best for our patients. So as Vetrehabbers, this episode will give you valuable insights to better guide your clients, assess risk, and support the well-being of the dogs in your care no matter what stage of life they're in. Now, if you're looking to update your continuing education, we've got 3 flexible ways for you to learn with us at Onlinepethealth. The first one, you can join for free. So you can sign up for a webinar of your choice and attend the session live at the scheduled time. You can head over to onlinepethealth.com/free to sign up. Or you can purchase webinar access. So if you can't attend live, you can buy access and enjoy the webinar recording for 4 weeks at your convenience. Or you can become a member. So choose from our different memberships levels and unlock full access to all of our live webinars and a library of over 500 recorded sessions, our business basics training, and regular research updates. So a quick word from our sponsors before we dive in. At Paw Prosper, we believe true pet well-being demands a 3-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands Walking Pets, Help 'em Up, Response System, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts offer effective, innovative, and proven solutions. So you can sign up today to receive a one-time special gift for our online pet health business with your next order. You can sign up using the special link, pawprosper.com/OPH. Right, over to Nay and to discuss the study.
Hi Vetrehabbers, and welcome to this month's Research Refresh in your small animal membership. Before we get started, I want to give a shout out to Donna Sidebotham, who recommended that we cover this article. Thank you, Donna. I know that you're watching. You're always watching, and I really appreciate that. So to the rest of our members, if you have a recommendation or a request, please send it through to me, and I will include that in my Research Refresh lineup for the year. We love covering the topics that you guys are looking for. That's the goal, so let me know what you need. All right, so we're looking at vasectomy and ovary-sparing spay in dogs, a comparison of health and behavior outcomes with gonadectomized and sexually intact dogs. Our researchers here include Chris Zink, Michael Delgado, and Judith Stella. I think this is such a relevant topic. It was published when was it published? 2022? 2023, there we go. So March 2023, this was published. So relatively new. It's a very relevant topic. This was one of the things that came up at the Vetrehab Summit last year, which was a really big topic for discussion because it isn't anymore so clear what the right course of action is, what the best course of action is in terms of long-term health as well as behavior for our dogs. So as we just quickly look at the abstract, we can see that this includes 6,018 dog owners through a web-based survey done at the end of 2021 and beginning of 2022. So we're looking at a survey-based study. We can see that we're looking at a large amount of intact, large amount of castrated, a smaller amount of vasectomized. So these look like really good big numbers that will give us really good data. So let's jump right into it. Okay, so if we're thinking about spaying and neutering, 64% of dogs in the US are either spayed or neutered. Predominantly, this is being done by removing the gonad, so a spay or a neuter as we know it, or at least I'm going to refer to them as spay and neuter, versus, a gonadectomy or the other bigger words that you might be familiar with in other parts of the world. So the primary reasons why we would have a spay or neuter is for population control, right, to prevent breeding, to encourage good behavior or to reduce the occurrence of problematic or nuisance behavior, and because there is a perceived health benefit in dogs. So this health benefit has a lot more to it than just a health benefit, because there are some things that increase and some things that decrease when we have a spay or neuter. So age and breed are always going to play a role in this. The size of the dog is going to play a role in the health benefits. So for example, in males, we're looking at a health benefit of reduced testicular tumors, but there's an increased risk of prostatic carcinoma. In females, we're looking at a reduced risk of ovarian tumors, pyometra, or mammary cancer, but an increased risk of obesity when they're having a spay. And across the board, we're looking at potentially an increased risk of cancer, which increases in large breeds, an increased risk of obesity, an increased risk of orthopedic disorders, or immune and autoimmune disorders. All right, when we consider behavior, the behavioral component, then there is actually conflicting data when it comes to aggression. Does it actually increase or decrease when we have a spay or a neuter? Does fearfulness and aggression increase or decrease? These are very big things. So it is actually shown that fearfulness and aggression decrease in intact animals as they age and as they mature. So as they get older, that aggression and fearfulness will decrease. And I think that's really interesting and relevant. So as we're starting to question and consider alternatives, we're looking at things like a vasectomy or an ovary-sparing spay, where essentially we're retaining the sex hormones, but we are preventing reproduction, which is fantastic. So the objective of the study was to compare health and behavioral outcomes for dogs that underwent a vasectomy or an ovary-sparing spay, otherwise known as a hysterectomy, with sexually intact dogs and with dogs that had undergone a traditional castration or spay. To the best of the author's knowledge, there are no published reports of the effects of a vasectomy or hysterectomy on health, behavior, lifespan, or how these effects compare to dogs that are sexually intact or gonadectomized. All right, so let's go into our materials and our methods. They used SurveyMonkey over a 6-week period to collect data. They primarily were doing this through the Good Dogs community newsletters and through Facebook. So they were targeting largely a specific audience. If I understand it correctly, the Good Dog community is focused around responsible breeding. So how does that affect the data that they collected? It definitely might. They started off with asking demographic questions, then questions specific for the dog. One owner could fill out the survey as many times as they wanted for as many dogs as they had. And this could be relevant for, this was done for dogs that were alive and for dogs that had already passed away prior to the survey. So they then asked for their reproductive status, the age that they were when they had the procedure, and the reason that they had the procedure. They asked questions about orthopedic health, other health problems, behavioral problems, and then behavioral problems they divided into problem and nuisance behavior. So problem behaviors were aggression, fear, or severe anxiety, while nuisance behaviors are marking, mounting, or other. Okay. All right. In terms of their statistical analysis, what they did was they divided their outcomes into separate groups. So they divided outcomes into orthopedic problems, which included elbow hip dysplasia, patellar luxation, cruciate ligament ruptures, etc., and cancer, which included all kinds of cancer, obesity, endocrine disorders, reproductive disorders, other health concerns, and then behavior was divided into nuisance and problem behaviors. Okay. So looking at our results, they ended up with 6,018 valid surveys, which is just absolutely phenomenal. I think that's really great. All right, 3,753 dogs were living at the time of the survey, and 2,265 dogs were deceased. So this is important because it does sway some of the health data. Of course it does, because the dogs could be different ages. This included data for 1,000 sexually intact. Okay, I represented this for you in an easier to look at format. So the most represented was 2,281 spayed females, then 1,672 castrated males, neutered males, 1,056 intact males, and 792 intact females. And then these groups, ovary-sparing spay was only 159, so very much smaller, and vasectomized males at 58. So these two groups are really too small to properly compare them to the other groups at this point. And potentially that's just because these procedures are still a little bit newer. They're not implemented across the board as a sort of normal or first choice. So we might start to see this shift as more owners opt for a vasectomy or an ovary-sparing spay. I'm not sure. But I do think that right now these numbers are a little bit of a limitation in comparison. Okay. The respondents who specified their gender, 95% were female and 3% were male. I do think that is interesting because if we have, does this information change the group that we've just created? So if we look at 95% females who belong to the good dog responsible breeding group, how does that affect the data that they've collected and that they're presenting to us? Okay, so all right, let's look at the results. Oh, we are in the results, sorry. Okay, so health problems, starting with orthopedic problems. And again, kind of going through data like this can be really difficult. So I've represented it in a little bit of an easier to follow format. Okay, so the most represented problem would be problematic behavior at 32%, followed by cancer at 18%, other health conditions at 17%, orthopedic conditions 12%, nuisance behavior is 7%, endocrine disorders 5%, obesity 3%, and reproductive disorders 3%. Let's look at this in a little bit more detail. So if we look at our different groups, and now we're just considering, so we're going to look at health concerns, and then we're going to look at behavioral concerns separately. So in terms of health concerns, here we can have a really nice overview of which group is most affected, which would be our spayed females at 88%, 88% of spayed females are experiencing a health concern, and 78% of neutered males are experiencing a health concern. So cancer is our most significant in spayed females, followed by other, and then ortho in spayed females. Then we have endocrine disorders, obesity, followed by reproductive concerns. If we look at the neutered males, we have cancer, then ortho, then other, then endocrine, obesity, and reproductive concerns. Okay, if we look at our intact females, this is a much smaller group. Only 19% of intact females were reporting a health concern. And of that, other was the most significant, followed by reproductive, followed by ortho, cancer, and endocrine disorders. In our intact males, 41% of intact males reported a health concern, and again, other was the most significant, followed by cancer, ortho, reproductive, endocrine, and then obesity. In the vasectomy and ovary-sparing spay groups, this is quite interesting. So cancer would be the most significant there. And so the cancer is divided between the two, vasectomy and ovary-sparing. Orthopedic follows, but the entire 8% of orthopedic conditions or concerns fall within the ovary-sparing spay, as does obesity at under 1%, and reproductive concerns is also completely female. So only the ovary-sparing spay have issues in reproductive, ortho, and obesity, while both groups are representing this 10% in the cancer. So again, does our number of vasectomies that's really low affect this data? It definitely will, but this is interesting to note. If we then look at our problem behaviors and our nuisance behaviors, so one of the beliefs is that when we neuter our males, we have a reduced prevalence of problem behaviors, and that seems to be, I don't know. Okay, so the vasectomy and the ovary-sparing spay, this is really interesting, guys. So again, there's a difference between the males and the females here, and I've grouped them together, and maybe I should have separated them, but the entire 43% of problem behaviors in this group are within the ovary-sparing spays. They're not within the males, so it's not an increased aggression within males, okay? That's significant. There is no problem behavior reported within the vasectomized males. When we look at the nuisance behavior, that is predominantly in the vasectomized males, with 21% lying there and then 10% in the females. Importantly, with an increased time that these dogs have their gonads, and the bigger their size is, there is a decreased risk of both the nuisance and the problem behavior. Now, if we looked at our neutered males, we have a 53% occurrence of problem behavior, so aggression, anxiety, and a 11% occurrence of nuisance behavior, so marking. In intact males, so we're going 53%, intact males are showing 35% and 13% nuisance behavior. Very interesting. If we look at our intact females, they have 28% problem behavior and 4% nuisance behavior, while spayed females are showing 41% problem behavior and 6% nuisance behavior. So what do we do with that information? I think this really does require a little bit of a shift in our perspective. If we're thinking that 43% of ovary-sparing spays are experiencing problem behavior, what is happening there? Why is that happening? And how can we help these guys? And if we compare that 43% to spayed females, it's not much different. So 41 to 43%, that's really the same amount. And 28% in intact females. Why are our females having either aggression or anxiety issues? We need a little bit more information here. And then looking at the nuisance behaviors. So again, I'd love to know more specifically what are these dogs showing, because this is 21% vasectomized males compared to 13% nuisance behavior in the intact males and 11% in the neutered males. So there's definitely an increase here in the vasectomized males. So are they marking more? What is it that is increasing there? And how significant is that to us? So yeah, some interesting stuff there, I think, for us to consider. Let's see, there are some other correlations here as well. So if we look at other conditions, okay, there's a correlation between the time that they have their gonads and the risk. And that's inverse. So the longer that they're intact, the less risk there is. The risk increases with their size and with their age. So I think that's fair. In terms of reproductive issues, again, there's an increased risk with the size, and there's an increased risk the longer they remain intact. When we consider orthopedic problems, no, there's no other stuff there. When we look at cancer, an increased size will correlate to an increased risk, as with obesity, an increased size correlates to an increased risk. So I think some very interesting points to consider within those categories. Okay, let's go. Reproductive conditions, other health problems, problematic behavior, lifespan. Right, so intact males and intact female dogs had shorter lifespans. I think, again, that's interesting and something we should figure out why. Reasons for reproductive choices, I think, is also interesting. So if we're talking about keeping males and female dogs intact, this was done because they wanted to breed, or compete in conformation, or because there was a belief that sexually intact dogs are healthier, or because they saw no reason to have the surgery performed. Owners of intact females had concerns about orthopedic conditions, or intact males and intact females. They were concerned about orthopedic conditions. And then the dogs that had an ovary-sparing spay or a vasectomy felt that these procedures resulted in healthier dogs, and they wanted to prevent breeding. Or in female dogs, pyometra. So good reasons. For female spayed dogs, participants wanted to prevent breeding, pyometra, and to avoid managing a dog in heat, making life a little bit easier. With castrated males, this was done to prevent breeding, because it was recommended by a veterinarian, or because it was required by a breeder or a rescue organization. There were complications listed from the vasectomies or ovary-sparing spays, but I don't think that this data is really accurate enough for us to truly draw conclusions. I think for us to really look at complications, they need to focus a study on that, and not necessarily in a survey basis. Okay, so discussion. Their most important finding was that the longer the dogs remained intact, the less health concerns or behavioral issues they had, and the longer their lifespan was. Interesting. Their recommendation is that when we want to encourage this population control or prevent breeding, we should be considering vasectomies and ovary-sparing spays. We should be performing more of these alternative surgeries. So in terms of orthopedic problems, there's a reduced risk in the vasectomy, the ovary-sparing spayed, and the intact dogs versus the spayed or neutered dogs. In terms of cancer, have I got that highlighted? In terms of cancer, there is a lower risk in intact dogs versus the spayed or neutered dogs, and an increased risk in large breed dogs. Obesity in spayed, neutered, and ovary-sparing dogs increases. There's no correlation to the amount of time that the dogs remain intact. And this kind of indicates to us that there's a little bit more to this equation. It's not quite as simple as we might think that it is. So a little bit more thought needs to go in there. And then with the endocrine disorders or endocrine conditions, there's really no significant difference between the groups. And then with behavioral problems, there's a decreased risk with an increased time that the dogs remain intact. And so that's really interesting. The major limitations of the study is that there were too few dogs represented in the survey that had either undergone the vasectomy or the ovary-sparing spay, with a total of 217 in our entire group of 6,000 dogs. Because it was done as a survey in a retrospective fashion, this is limited by a recall bias. And because there's a combination of dogs that are living and no longer living, there will also be a difference in the health concerns that are presented within this group, right? Because a 2-year-old that's undergone an ovary-sparing spay or a vasectomy may not yet have cancer, but they might develop that in the future. Whereas if they've already passed away from cancer or then obviously we have that information and that data. So that is also a limitation. And then sending out the survey primarily through the good dog means that they would have targeted kind of one component of the population, one aspect of the population, and that might change the data if we include a wider representation of the population. So those would be the primary kind of concerns or limitations. Nonetheless, this data demonstrated potential health and behavior benefits to dogs of both sexes experiencing longer exposure to gonadal hormones, is kind of their conclusion. And so, they also quote the AVMA. The AVMA promotes the professional judgment of the veterinarian in developing an informed case-by-case assessment of each individual patient, taking into account all the potential risks and benefits of a spay or neuter. And I think that sums it up. We do actually need to consider a spay or neuter or alternative on a case-by-case basis. This rule that we like to paint, and I mean, I'm guilty of this, I believe all dogs should be spayed or neutered because it is the responsible thing to do as an owner. I will be shifting that perspective and that belief for myself, but the fact is that spay, neuter or alternative procedure needs to actually be considered on an individual case-by-case basis instead of as a rule for the population. I'd love to hear from you guys. Please let me know what your thoughts are and what you're taking away from this. I would love to know more about your beliefs, your recommendations around this, and how you guide owners when they are needing to make these decisions in young dogs. Let's have this conversation. Let's dive a little deeper into it, because it isn't just a simple right and wrong. It isn't just a simple yes or no. There are more considerations that we need to be making in this area. And with that, I want to say a big thank you to the authors who put in the time, energy, and effort to do this research and to publish it for us. It is not an easy process, and we appreciate and respect the work that has gone into that. So thank you so much for joining me today, and I look forward to hearing from you guys. Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.